So you should know the three layers of blood vessels. Tunica intima is sometimes also referred to as tunica interna, and tunica adventitia is sometimes referred to as tunica externa. You may see those in different textbooks, so be aware of those. You should also kind of have a feel for what's included within each tunic. The tunica intima or interna has got their internal elastic membrane, but the very innermost layer next to the lumen is endothelia and basement membrane. You should also know that when you get to capillaries, the capillary is only the endothelium and basement membrane of the tunica intima. All right, that allows for diffusion of gases through between the blood and the tissue surrounding. If you notice with the tunica adventitia on some larger vessels, you get what's referred to as vasa vasorum, which is literally vessels for the vessels. You have smaller blood vessels that will deliver oxygen, nutrients, etc., to the smooth muscle layer of the tunica media. As well, again, you should know the tunica media has the smooth muscle layer that regulates vasoconstriction, vasodilation, and a larger, kind of thicker external elastic membrane as well. You should be able to recognize an artery versus a vein if I give you a photomicrograph. The vein usually is very flattened, does not have much shape to it. The lumen is usually larger than the artery as well. But the one thing you should see in the artery, if you look closely, are the little black squiggles. If you remember, elastin stains black, so you're looking at the internal elastic membrane and the external elastic membrane, which has got more layers and much thicker usually than the internal elastic membrane. But you should be able to recognize an artery and a vein if I gave you a photomicrograph similar to what you see here. So you should know some basic differences in some of the arteries. The elastic arteries, you've got a relatively thick tunica media and is mostly connective tissue, or sorry, elastic connective tissue. Elastic arteries, you think the aorta, carotid artery, some of the larger arteries as they leave the heart, and these are typically thicker elastic layers than smooth muscle layers because they are stretching and rebounding back in response to uh, the cardiac output, the blood that the heart squeezes out with every heartbeat. What you feel as a pulse on distal arteries is basically that wave of expansion and contraction that happens with each beat of the heart. As you get farther away from the heart, the arteries turn into muscular arteries, which again is descriptive of the name. The tunica media is mostly smooth muscle. You get less elastic tissue and more muscle, and this is where you see a lot of the vasoconstriction and vasodilation to regulate the amount of blood flow to different parts of the body. So if I if I asked you, where you saw vasoconstriction and vasodilation, you would tell me muscular arteries. If I asked you, where you feel, or where the pulse that originates that you feel is, or where the wave originates that you feel is the pulse, you would say that that would be the elastic arteries. So out of this slide, you want to know, again, the arch vessels of the heart, but as they leave the heart, the very first vessel you have on the right side of the body there is the brachiocephalic artery, sometimes known as the brachiocephalic trunk. Again, tomato type of thing. You'll see it used in different, see it printed differently in different areas. The first branch, you have the subclavian artery that goes out and serves the arm, and you have the common carotid artery that splits and leaves and goes up towards the head. The common carotid will then split into the internal carotid, which goes into more internal and supplies the brain, and the external carotid artery, this is what it sounds like, it stays more external and supplies the musculature of the face and head. Also, one of the first branches of the subclavian artery is the vertebral artery. We'll talk about that with the next slide. The circle of Willis, the vertebral artery, and the internal carotid artery are the two supplies of blood for the brain. Again, the vertebral artery, if you remember from last semester, travels through the transverse foramina of all these cervical vertebrae. So the circle of Willis, or the cerebral arterial circle, as it's sometimes known, uh, again, you've got two inputs. The vertebral arteries, left and right, at the brain stem. They come in through the base of the brain, at the area of the medulla. They quickly merge to form the basilar artery as it travels across the surface of the pons. The basilar artery splits into the left and right posterior cerebral arteries that then turn back and supply the occipital lobe, kind of the posterior parts of the cerebrum. So the other input into the brain is through the left and right internal carotid arteries. After their first branch point, those arteries are known as the middle cerebral artery. One branch of the internal carotid artery is the anterior cerebral artery, again left and right. The anterior cerebral artery goes to more the frontal lobe. The middle cerebral artery serves more the kind of the posterior frontal / parietal lobe. And if you look at the branches of the internal carotid artery, again, one branch is the anterior cerebral artery that becomes connected to the other left or right to other sides anterior cerebral artery through the anterior communicating artery. The other branch of the internal carotid connects to the same blood supply that is brought in through the vertebral arteries through both left and right posterior communicating arteries. Okay, so you remember the blood input is through the vertebral arteries and through the internal carotid arteries. You end up having a anterior cerebral artery, a middle cerebral artery, and a posterior cerebral artery. And remember, there is a left and right posterior communicating artery that connects the blood input from the internal carotid to the same blood input system as the vertebral artery. And you have one singular anterior communicating artery that connects the left and right anterior cerebral arteries. So you should be able to identify parts of the circle of Willis if I give you a diagram like this, or a simple schematic as well. So out of this, you want to know, again, the ascending aorta is the first few inches, I'd say first inch or two, first few centimeters maybe, of the aorta. The only branches of the ascending aorta are your left and right coronary arteries. The aortic arch is just what it sounds like. It does a 180-degree turn, and you have three branches on the aortic arch. You have your brachiocephalic artery that goes to the right side of the head and arm. The brachiocephalic artery splits into your right subclavian and your right common carotid arteries. The next aortic arch branch is the left common carotid that goes to the left side of the head and face, and the left subclavian artery that goes to the left arm. As it turns down, it is known as the thoracic aorta until it reaches the diaphragm. Then from there below, it is known as the abdominal aorta. There's a lot more on here than you really need to know, but like I said, the things I go over are things you should focus on. So just a close-up of the top part of that diagram. Again, your aortic arch vessels, you should know the brachiocephalic artery, the right subclavian artery, the right common carotid artery, left common carotid artery, and your left subclavian artery. You should have an understanding for how those are arranged and organized. So as you go below the diaphragm, your abdominal aorta, the first large branch you have there is the celiac trunk. You should kind of be familiar with the celiac trunk, and I feel like you should probably know the major branches as well. If you look in your lab manual on, let's let's see, where is it? Table 21.4 on page 262, you have the celiac trunk. You got your left gastric artery, splenic artery, and common hepatic artery. The celiac trunk is the only place where you see three vessels coming off of the aorta at the same spot. The other arteries out of this group you should know are the renal arteries that supply blood to the kidneys, as well as the superior mesenteric artery, which supplies arterial blood to the mesentery of the small intestines, and the inferior mesenteric artery, which supplies blood to the large intestine. And the aorta terminates with the split of the left and right common iliac arteries. The left and right common iliacs go down to eventually the legs, but they have a split into the left and right internal iliac arteries that supply the organs of the pelvis, and the left and right external iliac arteries cross anterior to the pubic bone and supply the legs. So, kind of going back to the arch vessels, on the right side we have a brachiocephalic trunk or brachiocephalic artery, splits into the right common carotid up to the head, and the right subclavian, which, just as it sounds like, is deep to the clavicle. As that passes more towards the axillary region, you see the vessel turn into the axillary artery, and as you pass into the arm, that same vessel becomes the brachial artery. The brachial artery splits into the radial artery along the thumb side of the forearm and the ulnar artery along the pinky side, the medial side of the forearm. And with the external iliac artery, you have the common iliac artery again splits into the internal iliac that goes deep to the pelvis, to the pelvic organs, and the other branch is the external iliac artery, which again crosses anterior to the pelvis, becomes the femoral artery as it's near the femur, and goes from more superficial to more posterior position. Behind the knee, that same vessel is known as the popliteal artery. There you have a split, and you have the anterior tibial artery along the anterior side of the tibia, and the posterior tibial artery along the posterior tibia. The anterior tibial artery continues on to the dorsalis pedis that you can feel at the top of the foot. The dorsalis pedis is again one of the pulse points as well. So as I said in lecture, I will not hold you to veins, so you can stop at this slide, and no need to continue on.